Too many days in the darkness.
Welcome to Prevention is Cure, brought to you by PREKURE.com, the podcast which brings you the latest in science and practice and challenging mainstream medicine and finding new and exciting ways of having a happier and healthy life. This series is looking specifically at mental health. We've become really concerned about the lack of translation of what science knows into what medicine does. In most societies, including the one I live in, 1 in 5 of us will have a serious mental health problem at some stage. The infrastructure, the practice, the gap between treatment and best practice is massive. This podcast series aims to do something about it. Prevention is Cure. I'm your host, Professor Grant Schofield. Sophia Dawson is a clinical psychologist on our faculty here at PREKURE, and I sat down and talked to her about something that I've become very, very interested in, which is ACT, or acceptance commitment therapy. And I think once you talk to a practicing psychologist who's sitting down there day in, day out using these tools with particularly young people, but all sorts, I think see the power of these tools and how interesting and easily applicable they are to learning them yourself, both for your own benefit, but for helping others. Without further ado, let's get into this excellent interview with Sophia Dawson.
Too many days in the darkness without a glimpse of the light. Running tired and broken and scared, but I swear I'll never give up the fight.
Hi there, Grant Schofield here, and I'm with Sophia Dawson, a psychologist and the psychologist on the PREKURE faculty. How are you?
Hi, Grant. I'm good. Thank you. Thank you so much for having me.
So what I'm looking forward to is talking about what psychologists actually do, what a session looks like. Like, are we lying down on the couch with a pillow and talking about our childhood? What is it? What do you do?
Yes.
And I've been thinking about the different types of people that you would see and how that we describe some of those.
Yes.
And I'm most excited about talking about this ACT, acceptance commitment therapy, which you're pretty fond of and that sort of thing. So we'll get into it.
Absolutely. That sounds great.
Okay, so psychologist, what is a psychologist and how do you fit into the mental health field?
It's a great question. So what is a psychologist? So we see kind of a multitude of presentations. I guess that we're here to kind of assess, diagnose and treat psychological disorders or mental health troubles.
So someone will come into you and you will actually go, look, I've had a look at you, I think you have anxiety or depression.
Yeah, so we essentially, at the moment I'm working in private practice, so we'll get referrals from, say, GPs or schools, because I work with adolescents, or we get self-referrals as well. And so this might be people that are sort of struggling with like stress, anxiety, depression we see a lot of as well. And so I guess our job really is to just be able to really understand our client and kind of what's going on for them right now at this point in time, and why this particular presentation is occurring right now in this point in time, and then be able to support them to live the rich and meaningful life that they want to be able to live.
So how does it work out? Someone turns up, here I am, how long are you seen them for? What does your office even look like? And how do they feel? How do you feel? And just give us a feel for what goes on. Are they lying down on a couch? Are they sitting up in a chair? Or what?
Great question. So essentially, at the moment, I'm working with adolescents, and so we have a fantastic practice which is full of lots of toys. We have a lot of fidget toys which teenagers kind of dive to the second they come in the room with me. So if you've seen, there's lots of kind of TikTok sensations at the moment that are playing with these pop-it things. They're meant to simulate bubble wrap, lots of fidget cubes, slime.
You've got those you've got them there.
Yes, I've got them in. Slime, Play-Doh, kind of everything you can imagine that can be fun to fiddle with. So I've got all of that in my room. So you'd kind of walk in, the room's very playful, there's lots of colours in it. There is a couch and you can lie on it if you want to lie on it, but it's certainly not necessarily the must. So I guess the first time that we see a client, it would very much be really getting to learn about them, trying to understand kind of why they're here and what they're wanting to get out of coming to see me.
Are they nervous?
Yes, a lot of the time they're nervous because I think they just don't know what to expect. It's kind of like, are you expecting me to lie down here? What are you going to ask me? There's all sorts of thoughts that are kind of going through their mind.
And so that sort of rapport building, is that part of what you're doing to start with?
Absolutely.
Just trying to figure out where they're at and show that you're actually not that scary?
Yeah, exactly. Very much just showing that we're not scary. Sometimes even start with Guess Who or Jenga just to really kind of start to build that rapport.
Oh, Jenga, like the thing where you take the blocks out. You're having a game of Jenga and you're...
Absolutely. Yeah, so sometimes if it feels the client's just kind of really unsure and not sure what to expect and feeling a bit, maybe a bit anxious, it's a really good way to start.
Oh, right, okay, so you just straight into a game of Jenga?
Yeah, exactly.
Right, okay, that's cool. And then you're just asking a bunch of questions, or what happens then? Yeah,
absolutely. So that first kind of session that we meet a client will very much be an assessment. So I'd be asking kind of, about what sort of brought them in, and particularly with adolescents, it's also asking parents, what is it that you feel?
Do you have a parent there sometimes as well?
Yeah, absolutely. We'd sort of start with the parent, and then the rest of the assessment session would mainly be with the young person.
Yep.
And so it's very much just trying to understand them. I'll ask a lot about, I guess, their family, school, friends, stresses in particular that they're experiencing, and most importantly kind of about their goals and where they would like to be, really.
Okay, and then do you say, I think you've got a bit of depression, or do you actually give a diagnosis like that? Do you say those words, or how does that work?
I guess it very much kind of depends on the practitioner, to be completely honest. So I think a lot of the time, well, sometimes diagnoses and labels can feel quite stigmatizing for a person, and I guess we'll talk a little bit later about kind of how we can get fused with these things. So kind of use these labels as defining for us. But for others, it's quite helpful. And so being able to, some people feel like, gosh, am I the only person experiencing this? Like, is there something wrong with me? I think sometimes having a diagnosis can really support that. But it wouldn't necessarily be in that kind of first session where you'd put a name to it. But it could be that we might kind of further explore what's being presented, whether it's anxiety or depression, and then sort of go from there, do a little bit more questioning and psychometrics.
And you're not the only psychologists, aren't the only people in the mental health workforce. What else is there? There's a psychiatrist. How are they different? What do they do? How do you work with them?
So we work in our practice quite closely with psychiatrists. So they they have the role of being able to prescribe medication, which psychologists cannot do. And so they might prescribe medication for example, anxiety, depression, ADHD is quite a big one as well that we see. And so that's sort of how they are differentiated.
And is that their main job, doing that?
I think for some psychiatrists, that is sort of their main job, is being able to assess the client in front of them and sort of determine whether they might require medication, but also we use them to support us in diagnostic clarity. So, for example, if I think possibly my client's starting to show some signs of bipolar, for example, or maybe autism spectrum disorder, then I might get that.
Right, so it's moving past something to do with just mild or moderate anxiety or depression or something, and moving into something more clinical, then you probably got some support with that?
Yes, that's exactly
and then what about at the other side, you've got people who are doing counselling, social working, health coaching. How would that all work?
Yes, I think so. We all kind of, I guess, have our different scopes of practice. So for psychologists, we have a few kind of core documents that guide our practice, like the core competencies, the code of ethics. And so this kind of tells us what is in our scope and possibly what isn't. And so I guess that's how we kind of differentiate from, for example, counsellors or occupational therapists. But for, say, counsellors, someone might see a counsellor maybe for more kind of stresses in their life. It might be if, for example, for adults, maybe I'm going through like a marriage breakdown, or I just want to talk about some really tough stuff that's going on with some of my friends. That's sort of a talking therapy that isn't directly related to, say, anxiety or having depression.
And what about psychologists with things like diet, exercise, sleep, that sort of stuff. You do that stuff?
So I think, again, it very much depends on the practitioner. That's certainly something that I like to integrate into my practice, and something I'd like to integrate more into my practice as well, personally, because I think it's exceptionally important with kind of all the research we see on nutrition, in particular on mental health. But it's certainly something that we are able to kind of look into in terms of someone's diet and how active they are. Would certainly kind of come into it. Yeah.
Hey, so then you're out and about doing stuff. What I want to figure out now, so someone's getting to the point where you're saying, they've got depression.
Yes.
Like, what does that even look like? What does that mean? And how's that different from me just feeling down tomorrow or yesterday or today?
Yeah, absolutely. So I suppose someone with a diagnosis of depression, it would need to be sort of long term. So for example, with adolescents, if we're looking at depression, we need to have seen the symptoms for around 12 months. And it needs to be having quite a significant impact on one's kind of day-to-day functioning. So in terms of what we might see in practice, it could be someone who is experiencing very low mood. Their sleep might be really poor in terms of they might not be having enough, or they might be having kind of too much. Their appetite might be decreased. They feel like, hey, all the things I used to do, I actually don't like them anymore, and I have no interest in them anymore. So that we also start to see
that idea of just not being able to feel pleasure, and is that
absolutely. That's what we would call anhedonia. So it's very much that kind of loss of excitement or interest in what one might usually have found that.
And when does it go from being mild or moderate to, I think they talk about major depressive disorder? What does that even mean?
Yeah, so I suppose, again, that's kind of the time frame that we might see on these symptoms, but also, again, kind of how much it is impacting your functioning, because there's always going to be sort of stresses in our lives where, maybe I fail a paper at university, or I have struggles in certain friendships, that's going to be
stressful. You're going to have low mood and feel crap for a while, but it's not going to, hopefully you come back from it.
Absolutely, and so it might just be that I start to feel a bit low. But when we start to talk about that more kind of moderate to severe, we're also starting to think about kind of a high level of risk. So that might include kind of thoughts of self-harm or self-harming behaviours or thoughts of suicide.
And people will tell you about that. That's a thing. They're quite happy to open up about that, and I guess that's why they're there, right?
Absolutely. I think for some, of course, for all people, that's very tough to be able to open up and talk about, because it feels very personal, and it may be something that nobody else kind of knows about in their lives. So yes, for most clients, we are able to sort of talk about that, but for others, they feel worried, particularly with adolescents, that I'm going to tell mum and dad, or tell kind of someone else important in their lives, and so they might kind of be a bit more they might withhold that information a little bit more.
And then if you've got anxiety, what's that mean?
So anxiety is very much, I guess, a constellation of sort of cognitive, emotional and behavioural symptoms which one might experience in terms of their thinking. They might kind of think the worst, catastrophise all the time, kind of think, oh my goodness, but what if I leave the house today and I have this giant panic attack and then I just combust? And
so panic attacks are part of it?
So with anxiety, there absolutely can be panic attacks, but they don't need, not for a diagnosis of anxiety. But one also might experience kind of avoidance. They might engage in behavioural, avoidance behaviours.
Yeah, and we'll do that from time to time, right?
Absolutely.
I'll get worried about this, so maybe I just won't go.
Absolutely, absolutely.
So, and there's different types, right? You can have a generalised anxiety, but through something like OCD, but there's different ways of anxiety coming out?
There absolutely is. So as you say, there's generalised anxiety disorder, social anxiety disorder, but they all sort of they have sort of similar symptoms in the way that one's body kind of might experience that sort of heart racing, sweating, muscle tension.
Oh yeah, so there's physical symptoms as well, right?
Absolutely.
Your nervous system's just ramping right up.
Yes, that's the one.
And can you be depressed and anxious at the same time?
Yes, absolutely.
And that's pretty common, is it?
That's something that we would see quite commonly together, yes.
Yeah, okay. And then, so there's that sort of group of things. And would that make up the bulk of what you see?
Yes, it would. I think most commonly I would see sort of anxiety, depression, or features of either anxiety or depression, OCD. We see a bit of sort of ADHD and autism spectrum disorder, but I would say anxiety and depression.
Oh, yeah. So let's get onto the ADHD and autistic type stuff. What's going on there?
So I guess it very much depends on the client and kind of why they've come to treatment, but sometimes it may present that a client is feeling very anxious and having a lot of trouble in terms of managing those really big feelings of anxiety. There might be, I suppose, in session some features that I might sort of observe around kind of poor eye contact.
They're shifting their attention all the time and not really engaging. Is that part of it?
So with autism, it's kind of the poor eye contact, for example, the poor social interaction, having very restricted kind of interests.
Not taking notice of cues and stuff.
So having difficulty with social cues is certainly kind of something else.
And that affects their life quite badly because they can't interact with their peers.
It definitely can make interacting with peers quite tricky, absolutely. But I suppose we can learn some of these strategies to be able to interact with our peers a bit easier.
Oh, yeah.
So it may not be that they've kind of come to session sort of wanting a diagnosis of autism spectrum disorder, but it may be that there are sort of these features that I might observe, and then that can be sort of the basis for initiating more of an assessment around autism.
Oh, yeah. And what about ADHD? What's going on there?
So with ADHD, it may be that they are seeing a psychiatrist, for example, at our practice, and so are receiving medication, but they're also experiencing, say, anxiety or depression. So I would sort of work with the anxiety or depression.
But is the ADHD, like, what's happening for them? They're just having trouble concentrating, or they can't stay on task?
Yes.
How does it affect their life?
Yeah, absolutely. So it is very much that kind of poor concentration. They might actually notice, though, that their concentration can be sustained on things that they're quite interested in. Certainly losing focus. There might be some kind of behavioural difficulties that could be being picked up at school. Another really big sign is that emotion dysregulation. So feeling like you're on a bit of an emotional roller coaster quite a lot of the time.
And those emotions are playing out in public sometimes, and that's a problem.
Yeah, absolutely. And so it can be that they're feeling these really big emotions, and there might be a big, I suppose, behaviour that's suggestive of these really big emotions, and then they kind of feel fine, for example.
Okay, now what about some more serious stuff that you might see from time to time? So if someone has what we call psychosis or schizophrenia, are those the same things? What does that even mean? What if you've got that, what does that mean?
So it's not something that in private practice we would see very often. That might kind of be more, I suppose it might come out more sort of in the DHB. And maybe it may lead to sort of an inpatient admission. But in terms of kind of what we might see, for example, in schizophrenia, would be hallucinations. So that's kind of when your sensory world, so what I can see, hear, taste, touch and smell, might be actually quite different to what is really kind of going on in my reality.
So that's the whole hearing voices thing, is it?
That can certainly be part of it. I can be seeing things that other people can't see. And also in terms of delusions, I've kind of got these really rigid, firmly held beliefs that are just absolutely not true.
Like the government's coming to get me or something?
Totally. So that kind of persecutory delusions, absolutely it can be. The government's out to get me, maybe I'm God. For example, it can be those delusions of grandeur.
And this is pretty destructive, right, for especially a teenager?
Oh, it's very, very tough, and I think it's not something that we would kind of commonly see, and these sort of things might be starting to, may start to emerge.
Bipolar, what's that?
Bipolar, so that is when we might observe kind of these manic kind of symptoms and these depressive sort of symptoms. So in terms of mania, we might see someone who's kind of talking really fast. They might not need very much sleep. They're being very productive. They feel like I am absolutely invincible. And then they might have other periods where maybe they wake up the next day and actually they feel like I just feel like rubbish. I have no energy. I feel very low, having thoughts of suicide or self-harm. And I suppose kind of going between the two is what one might see in bipolar.
So what do you reckon about the pathology? Because some people that claim that some of the greatest inventions and minds in human history have been bipolar, and that's been one of the reasons they've been able to be, massively productive and absolutely on fire. Then they've crashed and burned and felt terrible and suicidal and all that, and then they've come back again and again, and that was actually not a bad thing.
Yes, yeah. I mean, I wouldn't see why that couldn't be the case, absolutely. I think there can be some incredible creative stuff that goes on when one is feeling either really manic or really low.
Yeah, and then the dark side of that is that you could actually harm yourself or do pretty poorly on those downsides, right?
Oh, absolutely. And there's definitely kind of a difficulty when one feels sort of indestructible and invincible.
Yeah.
And then kind of on the flip side, when you're back in that kind of low again feeling pretty hopeless and like nothing's kind of worth living for.
Okay, there's a whole class of things that I don't really understand, but you hear about these personality disorders.
Yes.
And I guess you don't see those so much with teenagers, but I know you've worked in prisons, and that was definitely something you saw there. So what even is a personality disorder? What's going on? And there's different types, right?
Yeah, absolutely. So I think in terms of working with the current kind of cohort that I am in teenagers, we can see some sort of emerging personality disorder kind of features, but one can't kind of gain a diagnosis of that until they're aged 18.
Yeah.
So even if we are seeing these features a bit younger, it's certainly that we can work with them and kind of work to prevent it from becoming a personality disorder. In terms of, I suppose, as you say, I worked in the forensic system for a couple of years, and it's certainly something that one would see more there. So personality disorders are persistent, problematic, and pervasive patterns of behaviour. So it's very much that I suppose.
Bad.
Well, I suppose their way of relating to themselves, other people in the world, is actually just quite tricky and quite problematic.
So if someone says, like, Sophia, you've got borderline personality disorder.
Yes.
What do they mean?
So I suppose they'd be referring to kind of a few features of my maybe behaviours and way that I see the world around possibly I might fear abandonment from other people.
Yep.
And so I want to keep people close to me, and in trying to keep people close to me, I actually kind of push them away.
Right.
It can also be having trouble kind of keeping my relationships with people because I suppose they're kind of described as being quite turbulent.
Yep.
So people with borderline personality disorder kind of describe feeling this kind of either love or hate, and everything is kind of either black or white or very rigid. And so it may be that in myself, one day I feel, oh my goodness, this person is amazing, and I might kind of idealize them as this amazing person, and then they do something and I'm just I hate them.
You flip completely in
absolutely.
That and that's obviously not going to work well in life.
No, absolutely not. And so it's very much also difficulty regulating one's emotions, because you can imagine how tough that would be, kind of constantly feeling that kind of love-hate, black-white kind of frame of mind.
Yeah.
And so it's very much feeling like I go from 0 to 100 very quickly, and it's a very slow return to baseline in terms of those emotions that I feel.
Okay, and what else do we have in this? There's a narcissistic personality disorder. What else have we got?
Yes, so there's 3 clusters of personality disorder. And so in terms of what I guess we're talking about, cluster B here, which is borderline personality disorder, narcissistic personality disorder, histrionic personality disorder, and another one that antisocial personality disorder as well. And so I guess what they're all kind of have in common is that they are across contexts in one's life. We see them kind of over a couple of years, these sort of patterns of certain behaviour, and they're problematic in terms of at my work, with my relationships with people, and how I see myself.
Right, so you're not necessarily seeing yourself accurately, or your interactions with other people aren't what other people would regard as normal, and do you lack insight?
I think a lot of the time we do sort of observe that lacking of insight, and I guess I've worked sort of more in terms of with that borderline personality sort of features of personality, and so it can certainly be that I don't have much insight into that, but we can sort of work on building that insight.
Yeah.
Yeah.
I guess there's other things that can go wrong with the brain, but we'll explore those elsewhere.
I think OCD is a very common one that I would work with as well.
Is that anxiety, or is that its own separate thing?
So I believe actually it did used to be an anxiety disorder, and now it's actually its own thing in terms of the DSM, the diagnostic manual that we use as psychologists in New Zealand.
And how's that commonly coming out? Is this like when people think of it's like excessive hand washing or something, but
absolutely.
It could be a whole lot of other things, right?
Yeah, absolutely. And so the idea, I guess, of OCD is that I'm having these kind of intrusive thoughts, images, memories, or urges that create this kind of sense of discomfort inside me or anxiety. And then I do these behaviours like compulsions to try and kind of reduce those feelings of anxiety or discomfort. And so that can absolutely manifest in kind of a number of different ways. So, for example, I might have an intrusive thought that I'm a murderer. And so a compulsion that I might have is kind of keeping myself away from the outside world and making sure I don't leave my bedroom because I'm a dangerous person.
Oh, really?
Yeah. So that's how OCD can manifest. Yeah.
Right, you're not having those thoughts.
I promise I'm not having those thoughts.
Okay, good. I guess psychologists talk about talking therapy.
Yes.
And that's just not sitting down and asking questions and hoping people talk, right? There's probably a little bit more to it than that.
Yes, that's right. So psychologists use evidence-based therapies with their clients to be able, I suppose, ultimately kind of facilitate change.
Yeah.
So in terms of our work with clients, it's very much being able to be quite goal-directed and having clients set goals for how they would like their life to be quite different, and us sort of working towards those goals together.
So let's have a look at a few of the different schools of thought here. So one's called CBT. What's that about?
Yeah, so that's cognitive behaviour therapy. And so I suppose a key feature of CBT, as it's called, is kind of identifying some really problematic thoughts that I might have and maybe being able to rationalise them. Or
mitigate them as well?
Yeah, absolutely. So kind of understanding the triggers that might facilitate some of those thoughts coming up. Also being able to manage, say, for example, feelings of anxiety. So I guess the intention would be to sort of lessen that over time if we're working with anxiety.
Okay, so I don't know, let's just think of something random. I drive home and the route I take home takes me to the KFC.
Yes.
And that invokes thoughts about eating junk food, and often I act out on that and just binge.
Yes.
And so would be a CBT solution to that, to take an alternative route home or something.
Yeah, absolutely. It would. That would be part of a CBT.
Yeah. And so that's sort of classical psychology training is CBT, right?
Absolutely.
And that's what you're trained in?
Yeah, so in New Zealand, CBT is certainly a fantastic evidence-based therapy for treating certain clinical presentations.
Yep.
So
yet you've gone away from that.
I have, yes, I have.
Yeah.
So
so tell me what's happened there and what you've gone to. I think this is really interesting, folks, so just stand by here.
Yeah. So I am very passionate about acceptance and commitment therapy.
Also called
ACT, so it is called ACT for short. And so this has kind of come from CBT, essentially.
Yeah.
So it's kind of a mindfulness-based behaviour therapy.
But also, like, you hear this, right? You hear ACT, and that sounds pretty benign, but you hear acceptance, commitment.
Yes.
It's starting to sound quite psychotherapy, Freudian.
Yeah.
But actually it's not that really, is it?
So it's very much, I suppose, what it is being able to assist clients and being able to kind of open up and make room for really difficult thoughts and feelings and experiences, and being able to support them in making kind of committed, values-guided actions.
So in plain language, I think the way you explained it to me, which I liked, and I'll see if I'm getting this right, is all of us think all sorts of things, and we have positive and negative emotions and thoughts about actions that we do or don't do.
Yes.
And sometimes, and that's normal, right?
Yeah.
It's a normal, you could be thinking, who knows what you're thinking.
Yeah, absolutely.
But some people get stuck on, especially the negative ones, and quite fixated on those and can't move out, and others of us accept that we're going to have a bunch of things and just choose to behave in a particular way.
That's right. So I think ACT very much kind of normalizes the psychological suffering kind of idea, because I suppose the idea is that our minds have evolved in a way to kind of facilitate suffering. So if we think about the caveman mind, for example, so back when we were cavemen, it was really important that we were always on the lookout for threat. So can you imagine if we weren't, we'd be eaten pretty quickly?
Yeah, it's been selected for in an evolutionary sense, right?
Absolutely.
Yeah.
And so it was also really important for us to fundamentally stay alive. So that meant that, for us to be able to be included in tribes, for example, so to have people around us, that would mean that we were also more likely to stay alive. So our minds have sort of evolved to problem solve very much.
Yeah.
And so that's why I constantly in practice always kind of talk about the caveman mind.
Right, so summarise that, we're talking about a brain that is, I think they call it the negativity bias, so you're on the lookout for interpreting even benign things as being potentially dangerous.
Yes, absolutely.
So you can see the use of that.
Oh, absolutely.
And there's a sort of wanting to belong to a group as well.
Absolutely.
And to solve problems that come at us have all been things that the mind's actively done, and that's what you call the caveman. You should be calling it the cave person mind.
Cave person, yes, sorry. We should be inclusive, you're right. The cave person mind.
Yeah,
absolutely.
Right. So,
absolutely. And it's absolutely kind of evolved in a way to keep us safe. And so really what it is doing is its number one kind of goal is protection of us, keeping us safe.
Yeah. And so we're going to think negative things. And so I hear you've talked to me about some of those exercises you will do with people to illustrate that mindset that these thoughts are normal and getting rid of them is not possible. Let's go through a few of those, the sort of deleting thoughts, the VW exercise, all that stuff.
Okay, so maybe if we can start with you thinking of the best day of your life.
Yeah.
So think of kind of the best memory you have right now.
Okay, so everyone out there can do that?
Everyone out there can do that.
Yeah.
So now I want you to delete it. Delete it from your mind.
No.
So don't think about it. Just to make sure it doesn't exist anymore.
Yeah, so that's not a thing.
I
can't do that. Can you do that?
I certainly cannot do that. Absolutely not. And so there's this idea, an act, that trying to get rid of certain thoughts or any thoughts and feelings actually has a paradoxical effect, which means that they kind of show up more.
Right, so the next step after the get rid of the best day of your life, which is an impossible thing, is I was calling it the polar bear exercise, but you're calling it the...
So this takes many forms. I think traditionally it might be known as the white bear exercise.
Yeah.
But another one that I've read about is, imagine a Volkswagen Beetle.
Yeah.
So a yellow Volkswagen Beetle, if you can imagine that.
Yeah, I'm imagining that now.
Have you got like a very clear image in your mind of what that looks like?
Yes.
Yeah. So if we think about it just for a few seconds and kind of focus on all the details of that, and then I want you not to think about it.
Yeah, it's not a thing.
It's not a thing, because your mind is trying to say, don't think about the yellow Volkswagen. Don't think about it.
Right, so your interaction with a client then is to say, hey, to try not to think about negative thoughts or try to concentrate on the negative thoughts is only going to magnify them.
Absolutely.
Yeah.
That's right. And I think these are some very kind of simple experiential exercises where people kind of recognize, I can't do that. It's not possible.
And in fact, engaging with them magnifies them.
Yes, absolutely. That's absolutely what some evidence does show. And the next step then could be, okay, so let's try that with a feeling then.
Yeah.
So what I might say is, okay, do you think that you could fall in love with the next person that walks through the door? If I gave you $1 million, could you do it?
How much?
You could pretend, maybe.
Yeah, right.
$1 million.
Yeah, but for authenticity, probably no, right? And people
Absolutely.
No one said yes to that, have they?
No one said yes to that. They've said, I could pretend, or I could try.
Yeah.
And of course, it's $1 million. I completely understand that. But I guess the foundation, the idea is I absolutely cannot do that.
Right.
Right. I could pretend, but I'm not going to feel those real kind of feelings of love.
Yeah.
Yeah.
Okay. And then there's another metaphor. I think ACT's quite full of metaphors, which sort of follows on nicely for this, is that the drop the rope exercise.
Yes,
How does that sort of feel with that? Because you're engaged. There's negative feelings and emotions, which are part of being a human,
absolutely,
are in your head.
Yes.
So tell us about the drop the rope.
So another idea is that we are kind of struggling with our thoughts and feelings. Yeah. So maybe a thought comes up of, I always use this one because it was very true of me at school, I'm really bad at maths.
Yeah.
And so I might really kind of struggle with that and struggle with feelings of anxiety that might show up in response to that thought. And so maybe I'm kind of trying to get rid of it, or I'm trying to not make it so loud. loud.
Yeah.
And that certainly I would need to do that if I had a maths test today.
Yeah.
I'd want to be trying to get rid of that. But I'm really kind of struggling with these thoughts and feelings. And so there's a metaphor of sort of imagining that maybe these thoughts and feelings or a monster is kind of on the other end of this rope and I'm on the other side. And maybe the monster is kind of these thoughts and feelings that I'm really struggling with.
Yeah.
And so at the moment, it's like we're in one giant game of tug of war. And so maybe I yank them kind of one direction and then they pull me in the other direction. But the idea is just being able to kind of drop the rope. And so not kind of engaging in that struggle, just dropping that struggle.
I've got this whole sort of vivid imagination of a sort of computer simulated monster with a rope, and as I pull the rope, it's essentially feeding them, and they're growing.
Absolutely.
And growing and growing, and they're becoming this massive monster that's the only thing I can see.
That's right.
And if I just let go of the rope and go, no, I'm not playing tug of war with you anymore, it's still there, but it bloop, 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 shrinks down in size.
Yes.
It's no longer everything. Is that's the drop the rope?
Absolutely, yes.
Yeah,
that's
okay.
it.
So I really like this idea for people that I've seen and had anything to do with through health coaching, and especially with depression, this sort of focus. So you talk about understanding self as context. What's that mean? Because that seems to be a thing there, right? Understanding that these thoughts aren't everything that defines you.
Yes, absolutely.
What's it about?
So this is the self as context part of ACT is a particularly complex one for a lot of people to try and understand. But a way that I kind of understand it and make sense of it is that, I can have these stories about myself and they can be quite complex webs of stories.
Yep.
They're kind of all tangled up in these thoughts and these feelings that I have about myself or about the world or about other people. And so I might kind of hold very tightly, for example, onto the story of maybe, for example, I'm anxious. And so if I hold really tightly onto that story and I kind of let that define me, firstly, I'm not actually making room for all the other things that kind of make up me. But it also means that I'm letting it kind of get in the way a lot of time as well. And so having these stories are not kind of inherently problematic, but when they become problematic, it's when they're starting to mean, for example, if my mind told me, oh, I'm anxious, I can't possibly do this maths test today. And so I just stay in bed all day and just avoid it.
Say for a teenager, they might just not go to school at all.
Yes, exactly, absolutely. So that's when that kind of story of myself has really kind of gotten quite rigid and is getting in the way of me kind of living the life that I want to live. Okay,
and you talk about this dots. What's dots in that context? What does that mean? These are avoidance strategies?
Yes, so dots are kind of ways that people might avoid things, I suppose, difficult kind of experiences inside. So D stands for distraction. So there's all sorts of ways that people distract. You can possibly imagine a few of the ways you might distract yourself. I, for example, might watch a Netflix show. Right? We might get kind of really caught up in watching Netflix, and every time we're feeling maybe a bit sad or upset, we might...
okay, so I can see, and that's not necessarily a good thing to do, because one thing, especially during COVID, because I didn't want to think about it and it was making me anxious, as I ended up just started playing Yahtzee on my iPad. And I don't think it's that good for me, but now I think I'm using it quite negatively as a strategy, a distracting strategy. So stop thinking about things.
Right. So you're making a very good point, because a lot of the time in the work psychologists do, for example, when it's kind of crisis kind of work, distraction is actually very important. It gives us kind of some space to be able to choose how I'm going to act next. But
as your only strategy, it's pretty hopeless.
Absolutely. If it's I'm kind of turning every time I have really difficult emotions or really difficult thoughts, every time I have those, I'm playing Yahtzee. That is kind of pushing away, or pushing, as we might talk about, like passengers out of the bus. We're kind of trying to get rid of these difficult thoughts and feelings.
And they're not going away, they're there.
No, absolutely.
And you need to maybe face up to them.
Yeah, that's right.
As normal.
Absolutely. As just a part of a normal functioning brain.
Okay, so that's D for distraction. What's O?
O is opting out.
Yeah.
So that could be, again, we use that kind of avoidance idea.
I'm not going to school. I'm not going to work. I'm not doing the maths test.
Absolutely. So
other examples?
Maybe social situations, so noticing that, hey, when I'm in hanging out with my friends, or maybe when I'm hanging out with people I don't know, I know I'm going to feel this sense of anxiety. My mind is telling me I'm going to experience anxiety.
Right, and part of that anxiety is you've got this, you're focusing on the thoughts. It's like, well, some of these people might not like me. I'm not dressed the same as them.
Yes.
They've got this, they've got that, which, naturally we all think some of these things, but it's acting on those and then opting out.
Absolutely,
Okay.
absolutely. And if that's kind of what I'm always doing, you can imagine that if, actually it's very important for me to be around friends, and it's important for my job to be around friends, then actually I'm kind of taking myself away from the life that I want to have.
Okay, T?
Yeah, T is time travel. So that is kind of, if I'm spending a lot of time kind of ruminating on the past, kind of thinking, and again, this is adaptive. When we fought tigers or lions, when we were cave people, it was important for us to replay that over and over again.
Just to figure out what happened, what went wrong, that they actually are quite dangerous.
Yes, and how to stay safe next time. So this element of time travel and kind of ruminating on the past is adaptive, but of course it's also kind of an avoidance strategy in the sense of I'm not kind of sitting with what's happening for me right now.
But you could do it all through. I could be sitting at home playing Yahtzee, not going out, and occasionally ruminating about the last time I went out.
Totally.
So
absolutely.
And there's an S here as well then, right?
There is an S. So S is substance use.
Oh, okay.
So, that's...
okay, so now I'm playing Yahtzee, staying at home, ruminating about last time I went out, how bad it was, and knocking back some...
gin.
Some gin,
Absolutely. Yeah.
And so that's a pretty common cluster of behaviours that you're trying to help people move past.
Absolutely. And I think, as I say, there's nothing kind of inherently wrong with any of these things. And so, playing Yahtzee, nothing wrong with it.
Yeah, but it could become problematic.
It could become problematic.
I think it is, frankly.
Okay, if it is problematic and it is kind of getting in the way of the person you want to be or the life that you want to have, that's when that's something that we'd be kind of thinking about together and working about, I guess, kind of...
Yeah. One thing that I think people might find interesting is that once we got talking about ACT, I was just reflecting on some coaching I was doing, not health coaching, but sports coaching with my youngest son's soccer or football team. And one thing that we did on the day of a tournament is I sat down with all the boys before we even left school for the tournament, and I was like, this is what we're doing today. Yeah, everyone excited about it? Yep. And I was like, what do you reckon the chances of the referee in each game making a mistake that goes against us is? And they sort of thought about it for a while, and everyone's like, it's 100%. Yeah. That's definitely going to happen. And I was like, how are you going to feel? And they're all like, we'll be angry, we'll be feeling upset, we'll be happy about it. It's like, and then we said, what do you reckon we should do about it? How would that help or not help? And they were universally like, it's not going to help. And it really worked really well because, you're an 11-year-old boy, and a day's tournament, you want it to go well, and there's bad calls, and going and concentrating on it. And so it works really well as a technique. Is that ACT?
That absolutely. I think that's a fantastic example of how ACT can kind of just naturally show up in our lives, right? Because I think, maybe some 12-year-olds might have said, no, that's not fair. We need to tell the referee that they made a bad call and we need to do something about this. But I guess there's this idea of internal and external locus of control, right? So what's in my kind of internal locus are the things that I can control, which essentially kind of comes down to what I do, really, my behaviour. And then what's in the external locus of control is sort of everything else. So it's kind of recognising, hey, there's actually nothing we can do here about these calls, and we're just going to make room for it and continue working towards that goal of what's important to us.
But the interesting thing there, that what we were doing there is actually, I guess you call it negative visualisation, which sort of runs counter to everything in society. It's like, let's just imagine when things go wrong. Which is a weird thing, right?
Yeah, it is. But it's normalising things go wrong. Absolutely.
And understanding how you would respond.
Absolutely. And being able to just kind of accept that, hey, this is going to happen, but I can choose to kind of keep playing soccer and keep playing my best game of soccer and continue to work towards that goal of winning together. Yeah.
So just to continue with the soccer theme, in different positions, I think it becomes even more important. For example, if you're the goalkeeper, okay, you can do some brilliant saves from time to time, and that's great. But quite often, a goal will go in, and that's a normal thing. There's going to be goals scored in a game, and often because you're the goalkeeper, one will go past you. And so then, working with that kid with an ACT type thing's like an important thing, right?
Yeah, absolutely. Kind of recognising, hey, even the best soccer player in the world, kind of all of these soccer players, if they're in the Olympics at the moment, even they let
Goals
get
in.
past them. It's impossible to be like kind of a superhuman goalkeeper, right?
Yeah, which gets us onto this idea in humanity of perfection and the futility of that, and how does that fit into ACT?
Oh, absolutely. So I guess it's very much, a lot of the time we can kind of hold on to this idea of being perfect, and we can get kind of what's called fused in ACT.
Yeah.
So getting kind of hooked on this idea, I have to be perfect, I must do my best. And this can kind of lead to all sorts of what we would call unworkable actions.
Yeah.
So those are sort of actions that are taking us away from that rich and meaningful life, away from the person that we want to be, because I have to be perfect. So
And if you can't be, you might go back to the dots, you might distract, you might opt out, you might worry about it, you might substance
yes,
use,
absolutely.
right? So those are common strategies to when there's fusion, you can't be perfect,
Yes.
you can't make it. And even so, is it like let's take a teenager in a social situation, someone might say something negative about you, or someone might not like you. Like, that's normal, right?
Absolutely, because we can't control kind of what other people say or what other people think about us.
Right.
It doesn't make it kind of any less difficult, right?
But it's going to happen, right? You're out with 10 other people your age. Chances are one of them's a bit of a knob and is going to say something stupid and something, or take a dislike to you, or something's going to happen that's slightly negative, right?
Absolutely, absolutely.
Even if it's a throwaway.
Yes, absolutely. And I mean, those happen all the time, right? Where people just kind of say a kind of throwaway comment, but we can kind of, I guess, fuse with this and think, I'm unlikable.
Yeah.
People don't like me.
Yeah.
And we really kind of want to be able to help our client kind of think, well, is this way of thinking, is that taking you towards that life that you want to have, or is it taking you away?
Okay, so we'll explore that. So let's go from fusion to diffusion, then we'll get into this choice points and towards moves and away moves. So you talked about fusion, which is being sort of welded to that. What's diffusion? Yeah,
so diffusion is, I suppose, the process of being able to see thoughts as thoughts, right? And so the idea is that our minds 24/7 are kind of throwing us thoughts, and we as humans, understandably, can sometimes get into the trap of seeing our thoughts as either true or false, right or wrong, and we can get very kind of hooked by them, and very fused by them. So the idea of diffusion is that we want to be able to see these thoughts as being thoughts and kind of be able to what's called unhook from them, and then kind of continue to choose to make towards moves, which we can talk about shortly.
Yeah, so when you talk about this clouds in the sky type analogy, what was that about?
Yeah, so I guess that's very much kind of, that can be related to fusion. It can also be related to the self as context. What we mentioned before is that, we can imagine ourselves as the sky. For example, we are kind of always there. And then we can imagine these really difficult thoughts and feelings as being like the weather. So there might be kind of storm clouds that come along every now and again, and they might be particularly problematic. But we know that sort of eventually they will kind of float away, and then the sun will come again.
Or there might be just little clouds floating around.
Absolutely.
And you can choose to say it's partly cloudy or mostly sunny.
Exactly.
Yeah, okay.
Yeah.
Okay, this gets to this choice point thing about because we sort of keep touching on that, we need to get into this.
Yes.
So this is a major technique you're using, right? So tell me about that.
Yeah, so the choice point is a really kind of amazing concept, and I constantly refer to this with my clients. So there's this idea that kind of as humans, of course, we're making decisions, making choices kind of all day, every day, right? We're choosing to come to work or choosing not to come to work, depending on who you are. We're making choices that are fundamentally either kind of taking us towards the person and the life that we want for ourselves, towards the person that we want to be, or they're taking us away from that rich and meaningful life and away from the person that we really want to be. And so what I guess ask my clients to think about with me is maybe a particular situation. And again, I'm going to use this maths example of, say I have a maths test today.
You really don't like your maths?
I really don't. I really don't like maths.
But you did a couple of psychology degrees. Like you have to do maths, don't you?
You do. You have to do statistics.
Oh my God.
And so I can use this as my exact example is, let's say the situation is I have to do statistics papers at university. And my thoughts are, I am so bad at maths. And that
I don't want to do maths.
I don't want to do it.
How do I get out of doing maths?
Yeah, maybe I just shouldn't do psychology because I'm so bad at maths. And then I might have feelings of kind of anxiety or sadness around it, dread, all sorts of feelings. So there's this idea that we can either make a move that is, again, towards or away. So an away move in this situation, something that has taken me away from the life I want to have, the person I want to be, might be me kind of getting hooked on that idea of, I suck at maths, I'm going to fail this test.
So you're fused to that idea?
I've fused to that idea. I've been hooked by it, and I'm thinking, oh gosh, I'm going to fail those statistics papers.
Yeah.
So maybe an away move, keeping in mind that what's important to me is being a psychologist and is passing my psychology degree.
Yeah.
An away move might be, just completely avoiding the exam altogether. So maybe
or even if you don't do that, just not studying,
not asking for help.
Yeah.
Not there might be a friend that I have that's particularly good at maths, which I certainly do have, that maybe I just kind of avoid, and I don't make any kind of effort to help myself there.
And what's a towards move then?
So towards move would be being able to kind of unhook from those thoughts and being able to see the fact that, actually being a psychologist is very important to me.
Yeah.
And to be a psychologist, I need to do these statistics papers.
Yeah. And you can be doing a towards move going, I actually do suck a bit at maths.
Totally.
Yeah.
Absolutely. And it's still the idea that I'm having these thoughts. I'm still having these thoughts that I suck at maths and maybe I'll fail.
Yeah.
But a towards move might be asking for help, getting myself a tutor, asking my friends, and showing up. Or
just even setting up a study plan to start with.
Absolutely.
Yeah.
Absolutely.
So can you give me some sort of example from, I don't know, just in practice recently with towards moves and away moves that were real that someone was doing?
Yeah, absolutely. I think there's quite a few examples, and I think a lot of psychologists that work with children or teenagers at the moment can probably identify with people just not wanting to go to school.
Yep.
And there might be kind of a number of reasons for that. It could be, let's for example say it's a result of feeling a really big sense of anxiety.
Yep.
And so it could be maybe the social side of school, for example, is just, people don't like me, teachers don't like me. I'm going to feel anxious, I'm going to have a panic attack, right? And so an away move, assuming that these clients want to kind of pass school and head on to maybe university or doing something else afterwards, an away move is just staying in bed. Right? Like even with help provided by certain services to support them in doing their schoolwork, maybe they're not doing that. They're just kind of avoiding the whole idea of school altogether.
And then towards move?
A towards move might be gradually kind of, I suppose, engaging with someone like me to support them in getting back to school. It's not necessarily kind of jumping right back into school, but it can even be, hey, today I'm going to spend 30 minutes on English. And that is a towards move.
Yeah. So the one thing I like about this, there's a couple of things I want to explore here. First of all, what you said there was that assuming people want to have a good life.
Yes.
Like you actually do exercises on that, right? What these values exercises and that. What is that? Because actually, you don't have to assume it. You can actually find out what they want.
Yeah, that's exactly right.
And how do you do that?
So values is a very big part of that. And so sometimes, I think in a lot of the work that I do, I like to make values quite explicit. And so I'll kind of start with a values exercise of supporting the client to identify what is important to them. So that can either be through, we have what's called values cards, where there's just these little cards with values like, say, communication, honesty, inner strength on them, and getting the client to kind of choose 3 of these cards for each different area of their life in terms of what's important.
So how does that work when you talk about area of their life? What do you mean by that?
So that could be the 4 different areas that I might think about is relationships, work and school, leisure, and then health. So that can be kind of physical and mental health. So actually kind of doing an explicit exercise like that. It even can come down to like, hey, you're about to have a 21st birthday party, for example. What do you hope your friends, what do you hope your mates, your family say about you? Right? So maybe it's, gosh, they're just such a kind, caring, compassionate person. Right? And then you've got what's important to your client, that you've got kind of a foot in the door there of understanding what's important to them.
And does everyone engages in that?
They do.
And no one's coming up even when they're pretty depressed and just going, I don't care, and I don't even have anything on this. Everyone says something?
Everyone does say something. I think ACT's kind of perspective on depression, one part of that is that this idea that people with depression are kind of disconnected from their values, disconnected from what's important to them. So I always encourage my clients to think about, hey, it doesn't need to be what you have right now. It can be what you would love to have, what you would like to have. In an ideal world, if we could wave a magic wand. And
it's quite a common thing for people to engage in these tasks even outside of ACT, isn't it? You know, you're talking to your child, or you're talking to your partner, or you're just thinking about yourself.
Absolutely.
It's often a task that people like to do.
Absolutely, thinking about what's important. And I think this is, I guess, ACT has more kind of structural ways of being able to sit down and think, okay, what is actually important to me?
Sophia, another thing which I'm having tried, you read about ACT, and we've done all these towards, where's, away moves, the thoughts and feelings and the caveman mind, the fix-it mindset, all that sort of stuff. But then there's another whole section on mindfulness. It doesn't seem to quite to gel with the whole thing. What's mindfulness about there?
Yeah, so I suppose mindfulness is kind of pops up in all aspects of ACT, really. It's something that we're kind of constantly kind of referring back to, and I don't think it's kind of that typical mindfulness that people might sort of be thinking about. I mean, I don't know what the people listening here might be kind of thinking, but maybe they think of kind of sitting with your eyes closed and just trying not to think of anything. Yeah, right.
Yeah.
But mindfulness is very much, I suppose, being kind of, in terms of ACT, is kind of being in the present moment and kind of being able to observe, notice, describe
non-judgmentally
kind of what's going on for me.
Oh, okay. So now I'm getting it, because I was definitely thinking the other way around. So you're just going, okay, so I'll give an example.
Yeah.
I've come home from work.
Yes.
And you know, the two teenagers, one almost teenager, and the dog, and Louise have been home.
Yeah.
And because I've been living there, just doing stuff, and they're not particularly tired, you know, it's a bomb site. And then by being mindful, I might observe the different thoughts coming into my mind at that point.
Absolutely.
And some of them might be like, why the hell didn't these people clean up? What the hell's wrong with them?
Yeah.
And also that I'm home, and now that's good, and everyone that I love is there.
Yes.
Yeah. So is that what we're talking about?
That's absolutely right. So I think kind of, I suppose before kind of yelling at everybody in the house for not tidying up, for example, maybe being mindful would be...
You're suggesting that I would have done that?
Maybe.
No, definitely don't. That's absolutely what happened. It's had been an issue, right? Because I come home and completely lose it. It's like, what the hell's wrong with you people?
But gosh, you're not alone there, because I think a lot of people can relate to that example, right? But I think the idea of mindfulness is being able to kind of observe, noticing, like it's like kind of as if I'm an alien, right? And I've never felt these feelings before. I've never had these thoughts before. Kind of being curious about my own experience of, gosh, you know, what thoughts am I having right now? What are the feelings that I'm feeling in my body, and kind of where am I feeling that? If it's that anger of, you know, why didn't you clean up today? Is that kind of in my chest? Am I noticing this kind of hot sort of burning sensation going on in my chest? Is it kind of creeping up my throat and into my jaw? You know, where am I noticing that for myself?
And so then it's acknowledging that it's okay to feel that.
Yeah,
but then my away moves to completely lose the plot, which has happened.
Well, exactly. And I mean, I suppose if your kind of ideal kind of goal is, you know, to have this relationship and household that, you know, maybe talks about emotions and is really supportive of each other, maybe that would be an away move to kind of yell.
No, it definitely is an away move, but a towards move might not be not doing anything, but I might just gently help in getting the place sorted out, because I do, you know, it has to be sorted out eventually.
Absolutely. And so that could be kind of a committed action kind of idea, would be, you know, it's important for me, and it's important, if it is important to the family as well, to have a tidy house. You know, how can we just do kind of small little things that might contribute?
Okay, just to continue this little exploration into the mess. So here's another example for me. Don't judge me on this. You're a psychologist. You're not going to judge me, right?
No
judgment.
I'm not allowed to judge.
Yeah. Okay. Right. Good. So like I'm doing the dishes. I've got this whole 2-sink system worked out, right? So I've got the dishwater in one that's nice, and you know that I clean stuff, and I've got another sink I've written stuff out.
Yeah.
And then someone's made a berry smoothie in the NutriBullet, and they make the smoothie, and I'm just cleaning up around the sink area at that moment, and then they get this, you know, mostly empty but still covered in red smoothie stuff, and they just chuck it in my sink. And now it's completely red and my whole system's ruined, which sounds like a small thing, but I'm doing the dishes, right? And I'm like, I notice these thoughts of just going, you losers, I've got a system going here. Can you not put the bloody smoothie thing in the thing? I've got a system going, which is a big away move, right?
Yeah, certainly if you're yelling about it, absolutely.
Yeah.
But I think what ACT would say about that is, you know, it's absolutely kind of normal and understandable. You'd have those thoughts, right? Yeah. I imagine kind of along with those thoughts, you're feeling pretty angry. Yeah. Like, it feels pretty unfair. It's like, guys, come on, I have a system.
Yeah, and I'm the one actually doing the dishes here, so just put it over there and I will do it.
Yeah.
Yeah.
Yeah, absolutely.
And so what's a towards move?
So, gosh, a towards move might be being being able to kind of say, hey guys, it's really important to me that there is this system that is respected, right?
Yeah.
It's important to me. So maybe, we can all work together
Yeah.
to keep the berry smoothie out of my sink.
I have actually tried that, and that didn't work that well either. But I think the easiest thing is just to, it's not that hard to let the water out and put some more in.
Totally. Or maybe, it's for you being able to notice that, hey, maybe this isn't important to my family members.
Yeah,
and being
actually,
able to
really, who cares about the red water in the sink?
That's right, because ultimately my kids, my family are eating healthy, right? They're having these berry smoothies that are made in the NutriBullet.
Yeah.
So that's what's important to me.
Yeah.
So I guess it's kind of noticing that discomfort in yourself and recognizing that actually I don't need to kind of yell and make my point known.
But the important thing in this is this mindfulness, is be able to notice these thoughts and feelings before there's automatic action.
That's right.
Is that what you mean by mindfulness? Right?
That's right. And I think that's very much what ACT refers to, because I think some other sort of treatment modalities might refer to mindfulness as a way to kind of relax yourself, right? And that in ACT would actually be kind of experiential avoidance, because it's trying to kind of get rid of certain feelings to feel calmer.
Yeah, okay. So that's interesting, because mindfulness has all sorts of different other connotations.
That's right.
Society.
Whereas this is kind of being able, in terms of ACT, is being able to observe and describe non-judgmentally and just be that kind of observer of yourself, being curious.
Right, rather than you being the spotlight, you can just notice the thoughts.
Yes,
Okay,
absolutely.
that's cool.
Yeah.
Yeah. Okay, so let's get out of a sort of purely. I guess we're sort of already out of a therapeutic context and just into ACT in everyday life, because I think people can just learn this. It's a good tool for parenting. It's a good tool if you're coaching sports teams, like we talked about with the soccer team.
Yes.
It's good for yourself and relationships. So let's just think about a few different aspects where it might be interesting there.
Yeah, absolutely. I think possibly one that we could think about would be, you're a parent and you're about to take your toddler to the supermarket, for example, and you get to the supermarket, you're kind of going down different aisles, and then your toddler absolutely loses the plot and ends up kind of having a tantrum, right? And I think a lot of people as parents have been there, or maybe
absolutely.
you've been the person that's kind of noticed the toddler having a tantrum in the middle of the supermarket. So I guess one way that kind of ACT can come into this is sort of for the parent, right? Because as I think a lot of parents would think is, oh my goodness, this is so embarrassing. Everyone is looking at me, and so we can really get kind of fused on that feeling of embarrassment. Totally. Like, that's not okay. That is wrong to be kind of having a tantrum in the middle of the supermarket. And so if I start to get kind of fused on those thoughts of, or those feelings of embarrassment and those thoughts of, oh, this is not okay, this is not acceptable, I might then kind of, I guess, engage in an away move, because it may be that, of course, being a parent, it's very important for me to be able to kind of support my child and feeling their feelings and experiencing their emotions.
Completely losing the plot at your child in the supermarket. And people really are judging you at that point.
Ironically. So you kind of end up just yelling at your child, being like, no, this is not okay. What are you doing? Come on, be quiet, you know? And so we've really got fused with this thought of, oh my goodness, people are looking at me and people are judging me. But then what we've done is kind of made an away move in the sense of kind of being a parent, right? Because actually kind of yelling at my child and telling them that maybe feeling angry or feeling anxious kind of isn't acceptable. We're not allowed to feel that. So that, I guess that's maybe an example that people can relate to.
Okay, what about this, I don't know if people have teenagers and they go out to take the family out to dinner at a restaurant. It's like people do that, right? It's like a little move, you have a bit of nice family time. We're going out there to, have a nice meal and be together. But then what happens often with mine is that, because I'm into nutrition and stuff, I might ask the waiter or waitress something specific about the menu and, make a request. Can we have vegetables with that rather than pasta or rice or something? And, of course, what happens is that the teenage boys are like, oh my God, this is so embarrassing being out with dad. Like, him asking that is terrible. So and then they act on it by saying that, so that's an away move. So they have these thoughts and feelings about their dad being embarrassing. Which is entirely normal, right? Like, kids are going to think that.
Absolutely.
And they've acted on it. And then to make the whole thing, to completely sink the idea of having a fun family, that's ruined it to start with. I might turn around and say, well, we're actually paying for this. So if you don't really want to come, that's awesome. Your mother and me might just come by ourselves and have a date night, and that'd be awesome if you didn't come. And so I've had negative feelings and thoughts, and I've acted them on an away move as well. So we've both had negative feelings and thoughts that are predictable in advance.
Yes.
And both the kids and me have made an away move. And we come home pissed off, and then Louise gets angry because it wasn't much fun, and she had nothing to do with it being much fun. The kids said something, and I said something, and so then we might have an argument when we get home about that as well. It was just not act all over the place.
Yeah.
We could have resolved it right by understanding that we might think those things.
Absolutely. You can kind of prepare ahead, right?
Yeah.
And I suppose, you were also referring to, it sounds like everyone just wants to have a good time,
Yeah,
right?
sure.
Everybody just wants to have fun and kind of enjoy the dinner, but
Yeah.
we all kind of have these different ideas of what enjoying the dinner is.
Yeah.
For you, it might be, I don't want my teenage boys to think I'm a complete embarrassment.
Yeah.
But for the boys, it's like, oh gosh, I just hope Dad doesn't ask about the menu.
Yeah, and so could we
Right.
prepare for that in advance? And so on the way there in the car, we could joke around and go, Dad's going to do this,
Yeah.
and that'll be hilarious, eh? And it's like we could be actually normalising
Absolutely.
those things. Would that be an act?
That is, and I think ACT inherently is very playful,
Yeah.
I think as well, and so to be able to kind of just joke and laugh about that together, it kind of takes the power out of it, right? And that's kind of how we work with diffusion as well,
Yeah.
is we'll work with fusion, to be able to diffuse, is to be able to kind of joke around, kind of see this thing as, for example, just being a bit more
Your
playful
dad,
with it.
just watch this, it's going to be hilarious. What's Dad going to ask today? And
Yeah.
then they have a laugh, and then I have a laugh, and it's all actually quite funny.
Exactly.
But they don't get angry about it and lose it about the Dad's behaviour at dinner.
Totally. Let them mock you, let them impersonate you, and it might, for them, when it actually does kind of show up at dinner, they're like, oh, here he goes again.
Yeah. And then the funniest thing is that they end up doing it later as they grow up.
Yeah, exactly. Yeah, store that one away.
Yeah. Okay. So I think the interesting that I'm excited about ACT because I think health coaches can use it. It's a pretty powerful technique. We can use it therapeutically. We can use it in our lives. I love the sporting analogy of it. I like this idea, especially of a football goalie, for example.
Yes.
Yeah, it's like, you're gonna. There's no way you've let a goal in, no matter how good you were. They're still going to go in. There's no way you're turning around and going, "I was awesome."
Yeah.
You're going to feel stink.
Yes, absolutely.
It's just like there is no goalie that's never done that. But how is that going to detract from things by acting on that thought? And then you might, go into the dots and.
Exactly.
Yeah.
And make an away move, and then
Yeah.
just give up being a goalie altogether.
Yeah, and you see this all the time in kids' sport, right? Because a young kid will let through a goal, and he just goes and has a major meltdown, and his actual goalkeeping or her goalkeeping just goes to crap for the rest of the game. And
Absolutely.
And then it was the away move made things worse.
Absolutely.
Yeah.
Absolutely. One idea that I really kind of like in ACT, and this kind of, I guess, goes back to the caveman mind kind of idea, is the idea that our brains are kind of designed to fix things and to be kind of problem-solving machines, really.
Yeah.
And one thing, I guess, that I like to talk about with my clients is I ask them, what do you think if I was kind of running through the grass in summer, for example, and I got a prickle in my foot, what am I going to do? What would you do?
Yeah.
And they...
What's the answer? I'd stop and take it out.
Yeah, exactly. So they tell me, oh, well, you'd pull it out, right? And I'm like, yeah, exactly, because our brains kind of recognize it in our external world.
Yeah.
When there's pain, like a prickle in my foot, or when there's discomfort, like maybe I'm too hot, so I might take off my jacket, or I might kind of turn up the aircon.
Yeah.
I can fix things.
Yeah.
And so our brains kind of start to apply that rule to our
everything.
internal world. Yeah, so what's like inside our skin.
Yeah.
So thoughts and feelings, right? And so then I guess what it starts to do is start to think, okay, so if I can kind of get rid of pain in my external world, I can do that in my internal world as well. And so that can kind of manifest itself as, again, like we were talking about earlier, kind of trying to get rid of these thoughts and feelings.
And you can't.
You can't, exactly.
Yeah.
So that's a really kind of important
You're going
idea.
to, at some point, think your dad's a loser.
Yeah.
At
be
some point, you're going to get
embarrassed.
annoyed with your kids. Those are
Absolutely.
completely normal things, right?
Absolutely. And I think when we can kind of, I guess, support our clients to see that, support people to just notice, hey, this is just what a kind of properly functioning mind does, that kind of takes a bit of the sting and a bit of the heat out of things for them.
So there's some of these philosophies, right? Like Buddhism has this life is suffering. Stoicism, which is a more of an ancient Greek type philosophy rather than a religion, was this idea of positive and negative emotions being a completely normal part of life. Like it's impossible to have positive emotions without negative emotions. Like you must have that contrast. So it's not, in many ways, it's not. What we're talking about in ACT isn't new, right? Society's been thinking about these things forever.
Absolutely. And I think ACT, I guess the take that ACT has on it is actually, is we don't describe the thoughts or the feelings to be positive or negative. It's kind of unhelpful or helpful, workable or unworkable.
Yeah.
So you're exactly right. It's not the idea of kind of suffering being inherent in the human experience kind of certainly isn't new. And I think that's what ACT really kind of has going for it. It kind of normalizes that as being just a part of being human.
So people that society would look up to, the sporting heroes or leadership heroes or intellectual heroes, all of them, the whole time must be having positive and negative thoughts.
Totally. Yeah. So thoughts that they get hooked on as well, feelings that they get hooked on, absolutely. I'm sure that their minds are telling them, I had a rubbish game today. I'm so bad at this. I need to get better at that.
Yeah.
Absolutely. And I'm sure that they would be able to speak to getting hooked on these at times themselves.
Yeah, and then but then finding tools to get out of it.
Yeah, absolutely. Yeah.
All right, that's ACT. That's an intro to ACT. So get into it, guys. ACT.
You've been listening to Prevention is Cure, brought to you by PREKURE.com, with me, Professor Grant Schofield. At PREKURE, we're developing a way to help medicine help change the world. We're filling that gap. We're helping train health coaches and mental health coaches. We're bringing short but effective behaviour change programs over 29 days to you to help you learn for yourself and help others as well be healthier. We're trying to create a community of like-minded people like you who want to use the latest science and practice to change lives for the better. Join us at PREKURE.com. Get involved in our communities. We'd love to have you along for the ride. PREKURE.com.
Too many days in the darkness without a glimpse of the light. Running tired and broken and scared, but I swear I'll never give up the fight.